All right, welcome back. We're going to sterilize the tools this time here in the surgery prep area. Again, I'm Christina Fred. I'm one of the veterinary assistants here at DFL in this Shelter Veterinary Services area. So what I'm going to do, first we need to make sure we have gloves on because this Chlorhex scrub does irritate your skin and cause some itchy and dryness to your skin. So let's grab our gloves. They're usually located in this cupboard here. And grab whatever size. We usually have large, small, and medium. So I'm a medium, of course. We'll just put those on real quick. We'll go from there. So there's a couple different things that we use to sterilize tools with. We have a sponge, a little toothbrush, and of course we have some other things I'll show you too. So this is the sponge. If you do not have one of these sponges in your sink already, there is a place you can grab them. They're over here. On the other sink on the wall, it's kind of tucked behind. They're called the chlorhexidine scrub sponges. So grab one of those, go ahead and open it up. There will be a little blue piece that you have to pull out and throw in the trash, but otherwise you're ready to go. So, you have your sponge. We also have this little toothbrush guy. So this is also very good for the hinge cleaning parts and make sure we get all the gross and debris out of those tools. And for the ET tubes, which I'll show you how to do as well, these guys, we have to make sure we blow them up. So we need to make sure we have a plunger as well. Hold on one second. Hey, do you know where the plunger went? Oh, there it is. It's not where it's supposed to be. Okay, so for the ET tubes, we just have to make sure you have a syringe that, it doesn't matter how big it is, usually the 20 mils are a little bit better. So just make sure you pull it up with air, grab your ET tube, make sure you puff into the blue section only. So you just have to make sure you just go over it like that and push the air in. You don't want to push too fast, you just want to make sure it fills slightly. And you don't want to overblow it, so you just want to make sure you can still press on that bubble. So that guy is done. We can wash him. And then the bigger guys do require a little bit more air sometimes. So just, again, go slowly. If you have to unplug your syringe, you can do that. It does. There's a little mechanism here where you're pushing down with the syringe to put in the air. So it's okay if you let go of that pressure. But again, just slowly puff it up. And there you are. You want to make sure that, again, you can push gently on that bubble without popping it. There's that guy. So wash these guys first. So we have a mask in here as well. So this guy is used to give the oxygen to the animals before they're fully anesthetized. And what happens is they just put it over their mouth. So we want to make sure we clean the inside of there because a lot of that carbon dioxide that they're breathing out and the oxygen that is coming in is in there as well. So we want to make sure we scrub all that out. So we'll take our handy dandy sponge, make sure it's all dipped in the Chlorhex solution that is in the sink already, and just kind of scrub the inside of it, just like you would do with a glass at home. Make sure we get that all kind of clean in there. Do the outside as well. We'll scrub that and scrub this top piece. This top piece is important too because that's where it's connected to the tubing for the oxygen. So we make sure we scrub that. And what I like to do is I'll take one of our little scrub brushes like this and just kind of go in that hole as well and just kind of scrub the inside that you can't reach. Like that. Okay, once you scrubbed it, we're going to dunk it back in that sink the Chlorhex solution in the sink. So just dunk it like that, get most of the bubbles off. So you have that, and we're going to rinse it with water in the opposite sink. So don't add water to the Chlorhex sink, make sure you're always rinsing in the empty sink. Like that. Then this guy, once you're done with him, he'll go back here in the corner to dry. There is a towel sitting under there for it to dry on. The other part of this oxygen mask is the rubber piece. So again, we just want to make sure we are scrubbing the outside, the inside, and just making sure that we get those lips and everything. Because the more sterile it is, the better off for the animals over well-being for the next round it's used. So we'll just quickly scrub that guy. Again, use the softer side of the sponge. Don't use the bristles so much. We don't want to tear up the rubber part of this mask. Just like that. Okay, and then we're going to dip it again in that Chlorhex, get most of those bubbles out. And we're going to again rinse it off with water. Okay, once you rinsed it, all the bubbles are gone. We're going to take it and we're going to put it actually on top of that mask we washed before, so it dries like this. So then you know that the mask and the rubber piece are always together, and when they dry, we know where they are. All right, there's those guys. So we also have what's called the ET tube. So this is what's used when they anesthetize the animal to help them breathe throughout the surgery, to make sure that they are getting the proper oxygen content to their lungs when they need it. So we just want to make sure that, because these guys are very delicate, that we're actually delicate with them as well. So again, we're going to grab that sponge. We're going to scrub the outside of this guy, kind of like that, just gently working your way up the tube. Make sure you get that bubble really good. So we're going to just kind of go around the bubble, like so. And of course, you'll be doing this inside the sink. I'm just doing this for purposes so you can see what I'm doing. And then we're going to try to find the one that is the smallest to go inside the tube. So you don't want one too big because you'll actually break the tube. So this guy's our smaller one. This is for our 4.0, 3.0, and 3.5s. If this one is too big for your 3.0 size tubes, we also have pipe cleaners you can use. They're located in this drawer. So for that guy, we're just going to stick it at the top of it where the bubble is, kind of push it in there, and just gently work your way back and up using a twisting motion. And you're going to do that a couple times because occasionally what happens is mucus will build up when they're breathing in there, and we want to make sure we get all that mucus debris out of there. So once you do that a couple times and you don't see any debris, feel free to dunk it a couple times in the chlorhexidine solution and swish it around. And make sure you get all that debris out. Once you do that, we can rinse it with water. Again, go to your other side of the sink, rinse it with water. Make sure you put it all the way through so it's actually making that stream coming out. And just gently wash the tube. It's always good to double check because occasionally there is debris in this there's a little section of this tube where the air meets the bubble. So occasionally when you see debris like that in there, what we'll do to clean it out is actually get a 20 gauge needle. You can ask any assistant for this. Attach it to your syringe, and we're going to just fill it up with chlorhexidine wash and gently weasel it. There's a little hole here where the tubing meets the actual tube, and we're going to just plunge it through with chlorhexidine wash too. So occasionally, if you don't feel comfortable doing this, just ask your veterinary assistant to help you with that. But once we have washed it, we're going to put it on this drying rack that maintenance has built for us, and just put this piece will hook underneath into the little rails that we have here. So that will just slide on like that, and that's where it will dry. Next, we do have tools that come through our surgery suite, which is just right here, and we have two buckets. So what we do is we have a clean side, we have a dirty side. So the main part we're going to have you focus on is the dirty side. So what we'll do, open up your little cabinet here. You'll see that there's the two buckets like I was telling you earlier. Pull this bucket that has the chlorhexidine solution in. Be careful, it is full. And as you can see, there are tools in there for you. So we're going to take this to the sink and just gently put the tools into the sink and take this bucket back. You don't want to keep that bucket hostage too long just because they are doing surgeries as you're washing tools. So just make sure you return it at a timely manner. So for this guy, we have a spay neuter set in here. So what we do is we have different kinds of tools to wash. So again, there's that spay hook. So we'll be using the sponge on this guy. So the sponge, just make sure you get the handle, grab it, just like any knife or utensil that you have at home. Just kind of make sure you wash it up and down there, and make sure you get that curve of the hook because things do get stuck in there every once in a while. And of course, dunk it to make sure you got all the debris off. It looks pretty good. We'll rinse it, and it will go into this sonic. So what you'll do is, what I usually do is I'll scrub them all in the chlorhexidine, throw them in the sink and rinse them, and then throw them in the sonic all together. So you're not just doing one tool at a time. So we'll go on. We have some with hinges here. So this again is your needle driver. So we want to make sure we get the part where the needle is held by the pads here, and make sure, be careful when you're cleaning these guys, it is a little sharp. So it has a pair of scissors on there too. So for this guy, I like to use the bristle end for the hinges. So I'll just kind of scrub like that. Then I'll close them. Make sure there's nothing, because occasionally things get caught in this hinge piece. So you just want to make sure you close them. Scrub them like that. Make sure nothing is in there. Flip them over. Scrub them like that again. And if there is anything that's kind of there, you can also do this in the sink to get that debris out. But we also want to make sure we scrub those handles too to make sure they're very sterile. So just use the sponge side. Scrub them down like that. So you have a very soapy tool. Dunk them in. Make sure you don't have any debris. Always look and make sure there's nothing still attached. And then you can throw them in the sink so you can rinse them later. So we'll do a couple more of these. So we have car mults. So these guys are also kind of debris catchers. Just because of their racetracks, they're car mults. They will collect more debris. So if your sponge isn't getting it off, use your toothbrush. So this guy is a little bit hard bristled brush and it can get that debris out for you. We're just going to scrub it like that. Make sure we go with the grain there. So make sure your bristles are going the same direction as your racetracks are. And again, just make sure there's nothing in that hinge because occasionally things will just get caught in that hinge due to being dumped. So make sure we get that out. All right, moving on over. So we're going to rinse these guys. And we're going to throw them in this sonic cleaner. So take off your towel, take off your lid. So that's the lid there. Put it to the side. We're going to put them in there. And now we're going to make sure that the lid and the towel go back on. Because if you don't put the towel on, it's a very ugly sound. But make sure there's a dial clock on this guy. We want to make sure that we turn it to the 10. So we're going to turn to the 10. Just like that. So then 10 minutes later, go ahead and clean some other kennels, do whatever you need to do. But when it stops hissing at you, you can take them out. So it's quiet, so we can take them out. We're going to move them, we're going to dunk them here in our instrument lubrication milk. So make sure you take the lid off that guy. We're going to take them out, so you can take them out like this. Make sure your sink's on the way. Put them in your sink and gather the ones with hinges. So again, these are the guys with hinges. They need to be lubricated. The rest of them do not. So I like to put them all together in my fingers. So you can stack maybe 5 or 6 tools at one time and dunk them in together. Dunk them in the milk and also do this motion when you're in the milk. So you're actually getting the hinge lubricated. So once you do that, we're going to take these instruments and we're going to put them over here on our drying rack. So it doesn't matter how you stack them, just make sure you stack them so they're hinge open like this. And you can just gently stack them on top of each other like so.